from ABC News, live in Times Square. This is Good Morning America with Robin Roberts and George Stephanopoulos.
Coming up next, why millions of adults have attention deficit disorder and may not even know it. Don't go away.
Most people think of ADHD as a condition affecting kids that they can grow out of with some help. But millions of adults deal with it too, many without realizing exactly what they have or how to treat it. Now, Juju's here, and you're going to introduce two people who didn't know they had it, then got diagnosed and made a big difference. One of them is a good friend of yours.
A very good friend of mine, and it can be a life-altering diagnosis. It can really change people's lives. And, you know, you've all seen the signs. People are scattered, maybe, easily distracted, unorganized. Maybe you know someone who has had trouble holding a job or staying in a relationship. Well, many spend a lifetime thinking it's a character flaw, but it could be adult attention deficit disorder. In adults, it's wildly underdiagnosed. Many don't see it until they have kids.
It was life-defining because suddenly my whole life made sense.
I had given up trying to figure out why I was the way I was, and I just accepted it, and I was just, this is me.
Ashley McDermott and John Daly are among the nearly 5% of American adults, 8 million living with ADHD. Both busy working parents got diagnosed because one of their kids got diagnosed. 6 years ago, John's daughter, Kay, began showing signs of ADHD, and John realized it was like looking in the mirror.
As I was reading, I saw not only Kay, our daughter, but I saw myself.
A doctor confirmed his suspicions, and at age 36, John was diagnosed the very same day as his then 3-year-old daughter.
It was a big relief, actually. It gave us a name.
His 3 other kids are on the spectrum as well, but less severely. Married authors Ned and Sue Hallowell say adult women are often underdiagnosed.
Women do manifest differently. Often, this isn't true across the board, but many women are more of the daydreamy, inattentive type.
ADHD is genetically transmitted. There's no doubt about it. There are some cases you can acquire, but 95% of cases you acquire through the genes of your parents and grandparents.
As it turns out, when my close friend Ashley McDermott was researching her son's ADHD, she was astonished to find she was reading about herself.
Closed the book, the second chapter, and started to cry. I said, this is my whole life. I can't believe this is me.
Ashley struggled in school, and her lack of focus followed her into adulthood.
Every single report card, my entire childhood said the same thing, which is Ashley could be a very good student if she could calm down and stop talking and pay attention and focus.
John's academic struggles grew into career struggles.
I'd always hit walls in terms of trying to climb the job ladder and move on to bigger and better things. And a lot of it was because I couldn't get organized.
A combination of medication and behavioral therapies made John super productive at work. Bonuses followed.
I think the first year on the medication, we blew our numbers out of the water, and I got about a 145% bonus. It was absolutely enormous. We'd never seen that much money in one big fell swoop.
Ashley is about to publish a novel, a feat unimaginable before going on medication.
My ADD literally got so bad that I couldn't even read a book. So you have that constant noise in the back of your head, and you suddenly take your ADD medicine, and it's like someone turns the staticky radio off.
John has weaned himself off medication and has new strategies to cope with his ADHD.
If I know I've got a deadline, I'm actually going to shut myself away from everybody and focus on that in a nice quiet room, typically from my home office, as opposed to going into the office, because once I'm in the office, I'm talking to people.
Now, just to be clear, you hear people say both ADD and ADHD. The official clinical diagnosis is attention deficit hyperactivity disorder, but there are different types, and so most people just say ADHD. But I have to tell you, George, in working on this story, so many of my friends and colleagues are like, I think that's me, or I think that's
Absolutely.
A friend of mine.
It is very common. I want to bring in Dr. Ned Hallowell. We all saw him in the piece, and join us as well. Lots of people have it, much more common than you think, very high functioning people, my friend James Carville as well. But Dr. Hallowell, what should people watch for if they think they have it and it's starting to trouble them?
Well, unexplained underachievement. You know you could be doing better, and you're frustrated. You're trying really hard. It's sort of like driving on square wheels. Why is it so difficult for me to deliver what I know I have in me? And people say it's lack of effort. It's not lack of effort at all. It's that you can't focus. And that intermittent focus leads to underachievement, disorganization, procrastination, trouble just getting your act together. So people say you lack discipline. But it's not a matter of discipline. It's a matter of the neurological function of mental focus.
So if you're starting to have these feelings, how do you actually go and get diagnosed?
Go see someone who understands adult ADD. Most doctors don't. We've not done a good job of educating the profession. So go find a specialist who understands adult attention deficit disorder. It can change your life dramatically, take you from being a loser to a winner, truly turn your life around both personally and professionally.
We mentioned in the piece that women are very underdiagnosed, and that's a lot of because symptoms are different in women and often manifest differently.
Exactly. The women tend to be daydreamy, quiet. They're not disruptive like the hyperactive kind. And so they're dismissed as the ditzy blonde, the dumb blonde, or depressed. They get misdiagnosed as depressed and put on Prozac. That's the last thing they need. When they get the right diagnosis of ADD, then they transform their lives from being the underachiever to the winner.
So the treatment's not Prozac. What is the proper treatment?
Well, first of all, reframing it, education, learning what it is and what it isn't. Lifestyle changes, structure, exercise, and stimulant medication, the same meds we use in children, can dramatically help adults. And don't be afraid of medication. When it's used properly, it's very safe, very effective.
And is it the kind of thing where you can take medication for a time and then wean yourself off it, or is it something, once you start taking it, that's it?
Oh, no, not at all. You can take it for as long as you need it. You don't have to take it forever at all. You can take it, learn new habits, and wean yourself off. Or if you intend take it indefinitely, that's fine too, because when it's used properly, no side effects, and it's very, very safe.
And there are a lot of organizational behavioral treatments that people can do that beyond medication.
And that should always be part of it. Physical exercise matters a lot. A coach to help you get organized can help a great deal. Strategies in the workplace and at home. Delegate. Learn to. You should do what you're good at and delegate what you're bad at. Don't spend a lifetime trying to get good at what you're bad at.
That is great advice from Dr. Hallowell. Thank you both very much.